We're experts in hips here at Bath.
We're a centre of excellence. Everyone is highly skilled at their jobs.
We've come together because we've got a passion for getting our patients better.
The teams around us, whether it's the physiotherapists or the theatre nurses working with us, become specialists in their own right. Like everything in life, the more you do something, you're going to get better at it.
The care that they should receive should be spectacular. They're coming here and having the best care that they can.
Welcome everyone to the morning hip unit briefing, and we need to just talk a little bit about the cases we're going to be doing today.
The hip unit is a collection of surgeons, of rehabilitation therapists, and the building itself that enables us to treat patients and to get them better.
Working within the hip team, rather than as an individual surgeon, really benefits us all because it allows us to share difficult cases, share information and knowledge.
If you take the best bits out of everyone's practice and then create a unified pathway for the patients, then that helps everyone, whether it's the staff or the patients.
We can clearly see that there's osteoarthritis present. You may miss all this on a routine x-ray.
It's the old expression, 2 minds are better than 1. If you get people together who've really thought about things, they will be able to expand their knowledge and expand their expertise to get our patients the best result.
But it's not just us, it's everyone who works with us. It's the nurses, it's the theatre staff, it's our physiotherapists, occupational therapists, everyone coming together, bringing their skills to manage our patients in the most effective way. I think one of the major pluses of this hospital is the theatre team.
We're very lucky here. We have a dedicated team of specialist nurses that are very highly trained and know the procedures intimately.
Having a dedicated team allows me to concentrate on the job in hand. I haven't got to keep an eye on what they're doing because I know they know what they're doing. Okay, and flash there for me.
They are all highly skilled and specialised in particularly hip surgery, and often will go along to hip courses to further their learning.
When you understand what's happening within the hip replacement, you will know what instrument they will require, so you can have it ready to give to them, so you're not having, it's all about a good flow of practice, so you can then hand it to them pretty much before they've even asked for it. It's nice because they know your capabilities, so they know what trust to put in you, they know that you know what to do.
I almost don't have to say anything because everything is given to me, right bit of kit all the time. That makes the whole process so much more efficient.
You work as their second pair of hands, really. You're there to hold things, to give them a good view that they need inside the hip. You'll help them if there's any little bit of bleeding, even down to helping them put the dressing on at the end.
It allows me to be able to give each and every patient the best operation that I can.
It's not about speed, it's about getting things right first time.
By making things stress-free, by making things run smoothly, we significantly improve the patient's experience, but also patient safety.
Just like Formula One, you know, you watch the pit crews, it's very, very slick. They practiced it. If you're doing things repetitively, you're going to be better at that job.
And that's one of the reasons I believe we have such excellent results coming from the hip unit here at Bath.
So this is what a hip joint looks like, and what we've got is a very mobile ball in the socket there.
Key thing that we have here is joint school, and that leads into our enhanced recovery programme, and that's all about patient education.
As soon as your surgeon suggested you come for an operation for hip surgery, we'll invite you back 2 or 3 weeks later so that we can give you advice and support. You can plan for your surgery, feel like you're ready, you know what to expect. So we understand that when you come to hospital, you might be pretty frightened. Some people are frightened about just walking through the door, other people are frightened about the anaesthetic, the pain they might be in, and we feel that if we give you as much knowledge as we can before you come in, that we reduce those fears as soon as we possibly can.
Has everybody got?
So nothing on the day is a surprise to them because they know what to expect. And I think that gives the patients empowerment.
If you've got concerns at this stage, please let us know as soon as possible so we can help you.
They feel much more confident about going through a procedure which to all of us would be stressful. I mean, I've had surgery, you know, the night before an operation, you're anxious. That would be unnatural not to be. But if we can reduce that for all our patients, then that helps them not only their time in hospital, but also the lead up to it and after discharge as well.
Before you come to surgery, you know how to get your home ready, what your family need to expect.
So they understand how to use sticks, how to use crutches, how to go up and down stairs after surgery. So they're learning that before the operation, so it becomes much easier after the operation.
If things come as a surprise and a shock, it sometimes takes you a little bit of time to get used to the idea that what, they're going to make me get up out of bed. And actually, you know it's coming here. You've been educated before your surgery, and that really helps our patients get better quicker.
It's feeling comfortable. I don't have pain.
It's very important to get up and moving as quickly as possible. All of your body's systems work best with activity, and I think generally we're all aware of that nowadays. Our blood flows better, your healing is better, bruising will settle quicker.
So the sooner we get those muscles going, the sooner we get you balanced, the less reliant you'll be on crutches and the faster your hip will recover.
There's a lot of fear beforehand, so this is one of the reasons we get you up quite quickly nowadays. You might be quite nervous about this, but we're there to reassure you that actually it's a safe thing to do and it's actually good for you to get up and get moving.
Once they're back on the ward, we get them up, and within 2 or 3 days they're ready for discharge, where only maybe 5 or 6 years ago we were out at 5, 6, 7 days. So we've reduced that safely but quite significantly.
Any questions at all about the surgery?
Nothing I can think of.
I very much chose to work with hips, as I think if you have a problem with your arm, you can often quite easily put it in a sling and carry on day-to-day living very easily. If you have hip pain, it can be immensely disabling. Getting people's pain under control, getting people's function back is hugely rewarding.
Well done you did really well.
We want each and every patient to have the best possible experience and the fastest recovery.
And we can see just how much distress and discomfort people are in, and it gives enormous pleasure when we see those people again a few weeks later, even the day after the operation, quite emotionally relieved that that arthritic pain is already gone.
Being part of a hip unit and being part of a team and group of people that we know that we can give these patients the best care is so satisfying.
Great thing about being a hip surgeon is that our operation is one of the best operations in medicine. Hip replacement has been termed the operation of the 20th century. It has changed many millions of patients' lives.
Never fails to amaze me how quickly people heal and get back on the road to recovery.
You leave from work knowing you've made a massive difference to people's lives that day, and it's a nice feeling to get when you leave.